So I want to welcome everyone to Unsaid. I'm your host, Catie Whiting. And today we continue our conversation on all things motherhood. And we have Shatiera, who is a licensed clinical social worker and a perinatal mental health certified clinician here to join us and go over all things, I'll say all things infertility, but specializes in infertility, IVF, and the entire journey, I believe based on your own journey. So first, I welcome you to the show. Thanks for giving us your time today.
Thank you so much for having me. I'm really excited to be here.
Yes, awesome. We're glad to have you, and we'll just jump right in. I know that I do want to give note, and you can give yourself a little intro, but you are the owner, and I want to say it right, Seeds of Hope Counseling, and I believe you are licensed in multiple states, right? I think it said Georgia. Tell me the states so I get them right.
Yeah, Georgia, DC, Maryland, and Virginia.
And Virginia. Okay, that makes sense. So a cluster here and then Georgia. I'm over
Yes.
here. I'm in Chattanooga, Tennessee, so I'm close to the
Okay,
Georgia
cool.
line. Awesome. Well, you just introduce yourself. Tell us about you and how you got into this field.
Yes, so I am an IVF mama of
Yeah.
two. I have two amazing kids. One is 9, and the other is he'll be 7 in August. So I went through my own infertility journey for a few years after getting married, trying to conceive. Struggled with that. Later learned that we were diagnosed with male factor infertility. Originally, we were actually diagnosed with unexplained infertility. We both went through testing, everything showed normal. So, started with like least invasive treatment options. So, we did like timed intercourse, we did Clomid, and then we moved to IUIs. And with IUIs is where we learned that we had male factor infertility issues. And so, our diagnosis was then updated, and we were recommended to move forward with IVF, which we did and spent a whole lot of money. And so we now have completed our family, and we did move forward with IVF. So we have 2 IVF babies. And when I was pregnant with my son, I prior to my pregnancy with my son, I had been working with serious mental illness population. So folks who have schizophrenia, bipolar disorder, psychiatric hospitalizations, that's the population I was kind of working with up until that point. And then when I got pregnant, I took my licensing exam. Funny story, I took my licensing exam on July 27th, end of July, one of those days. And I had my son on August 13th.
Oh
So I was
my.
very, very pregnant when I got my license, my clinical license.
Yeah.
And so while on maternity leave, I started to kind of explore, okay, what's next for my career now that I'm licensed? What do I want to do? I knew that I did not particularly want to continue with serious mental illness population. Um, and as I was just kind of sitting with myself exploring, I kind of realized like, duh, like perinatal mental health, reproductive mental health,
Yeah.
this is like your alley. You went through it, like you can speak to it. And there wasn't a lot of support when I went through it.
Yeah.
So being able to kind of fill that gap in that space for other folks now that I was kind of done with my journey, I was looking forward to. So that's kind of how I slowly transitioned into this specialty.
Yeah, that's awesome. Awesome. Thank you. You did shared your journey in a nutshell perfectly. That was fabulous to get us on board. And we're grateful. And I saw, as I was studying your website and social media, like we said before, you're very open with your story and honest. And it went right into postpartum, right? Postpartum period with some postpartum challenges, we'll say for now until you explain it. But I think I really today, if it's cool with you, want to talk about infertility and your journey, but leading into like the I don't want to say the aftermath, but what can come after, right? There's like, I'm pregnant, it's magical. And then I find so many families are like, it's not as magical as I thought. Like, I
Yeah.
still feel bad. I still feel gross, right? So, from your practice and your perspective, do you see that? And tell us more about it.
Absolutely.
Yeah.
And actually, so I work with folks individually one-on-one who
Yeah.
are going through this journey, but I also do a lot of training and education and speaking for other therapists and providers on this topic, because a lot of folks start working with patients after they're pregnant, and they have a history of infertility. And it comes to a lot of folks as a surprise that oftentimes the goal is there's like this tunnel vision of like, I just need to get pregnant. I just need to get pregnant. I just need to get pregnant.
Uh-huh.
That's the goal. I want the baby. I want to get pregnant. And so then once you become pregnant, there can be a shift.
Yeah.
Um, and there's a shift in your identity, right? That like, oh, I went from potentially years and years of fertility treatments and being this infertile person and dealing with all of that came with that, to now like I'm pregnant, but I'm also not pregnant in the way that maybe some of my peers have just accidentally become pregnant on their own. So I don't quite fit in over there, but now I'm pregnant. So, and I don't want to, go over here and tell all my infertility friends that I'm pregnant. So I don't quite fit in over there either. And so now I'm like, there's like this, what now I kind of have learned this term around survivor's guilt. Like I know
Oh,
I'm familiar with the term survivor's guilt, but
sure.
only in the last few years have I heard it referred to in this context. And it was like a light bulb moment for me,
Yeah.
like, oh my gosh, even as someone 10 years later on this journey, that like it just was like, oh my gosh, this is exactly what I've been going through since, for the
Yeah.
past 10 years of getting pregnant and being on this journey. And so a lot of times folks just only focus on that. And so when you get pregnant though, there's that shifts in identity, but also like folks are getting pregnant, right? And so like you
Yeah.
can still experience, you're still at risk in the same way and sometimes a little bit more for perinatal mental health disorders. So like folks are surprised by, just potentially feeling depressed or anxious. Um, and when you've had infertility and when you've experienced even loss, sometimes the pregnancy test doesn't bring you the same amount of comfort and joy that you maybe anticipated it would,
Yeah.
right? Because after you get your pregnancy test, then you gotta come back in 2 days later to do another pregnancy test to confirm that everything is going the right way. There's this hyper vigilance on, is this pregnancy gonna sustain?
Yeah.
Right? Especially if you're working with a fertility clinic, you graduate, so to say, from the fertility clinic usually between 8 to 10 weeks pregnancy. And so like it's like, okay, is this really real? Is this going to happen? Am I going to make it to that
Yeah.
graduation stage? So folks can totally be thrown off and feeling very, very anxious, very nervous. You're still actively in the beginning in the throes of taking injections, intramuscular injections, taking medication. So you can still experience a lot of anxiety and depression, trauma symptoms. All of these things can still be very present even once you have a positive pregnancy test.
Yeah, absolutely. It's so interesting. It's a different framework, right? We have to sort of get used to a different perspective just because it's like, "Oh, I'm pregnant. Yay, that's it." That's not the case as the movies might draw out for us or whatever. So do you know, like side note, do you know if there's any research being done or have been done on like infertility and IVF and perinatal mood and anxiety disorders, like the correlation or the increase?
Yeah, so there has been a little bit of research that's been done.
Okay.
And I always get frustrated because whenever I'm training and speaking, I want to speak to that, but the
There's
research is so conflicting.
Sure.
You can read one research article that talks about there is a correlation, increased risk of anxiety and depression. And then you can read the next one that says, there's not.
Yeah.
And I think part of the reason from all of the research that I've done is that it's really hard to tell, is someone depressed or anxious because they got a positive pregnancy test now. And if you are still on the journey, you're less likely to say, I'm not depressed. You're less likely to have some of those feelings.
Yeah.
And so is it truly that, the connection to for infertility, or is it circumstances around the
Right.
infertility? And so that's why it's really hard, I think. But there is still a lot of research that is being done. There's some newer research that I learned about at a recent fertility counseling conference in April,
Okay.
that they are continuing to do research. So hopefully in years to come, there'll be more like definitive
Yeah.
research. But again, it's so, but I will say in my personal experience as a reproductive mental health therapist, I mean, I am a little biased, but I certainly see a lot. I mean, everybody that I see mostly has a history of infertility or is experiencing infertility and is experiencing perinatal mood and anxiety disorders, more specifically trauma, increased anxiety, and depression.
Yeah.
Those are the three main things that I see in pregnancy and postpartum and folks that have had infertility.
Yeah, absolutely. Which is it's research in its own, right? You're quantitative, absolute or qualitative, excuse me. But on that note, and I'm getting a little sidetracked, but being a licensed clinical social worker that you are, and I understand being one myself, how the social work training and brain works, right? Looking at the whole system and the whole story. Like when you are going through this journey alongside a family or a mother or whatever that looks like, when you're going through this journey, how do you sort of, maneuver through, like, here's the current, we are, going through the infertility journey, but there's also A, B, C, D, and E of the past and F, G, H over here. How do you sort of look at that whole picture while stepping?
Yeah, I think that yeah, it's a really good point to bring up because a lot of times this infertility
Mhm.
in the patients that I'm working with, and again, I'm biased here because I'm working with the folks who are reaching out, identifying,
Right.
recognizing that they need additional supports. But in the people that I'm working with, this can become their whole life. It can feel like their whole life. And so some of the work that we're doing is starting to kind of recognize and separate out that like they do have other things that are going on in their life. And for others, it is a huge burden on top of the other many stressors, employment stress, family stress,
Yeah.
all of the relationship stress,
Yeah.
right? Because just because we're trying to have a baby doesn't mean our relationship is
Mhm.
perfect, right? And so all of these other areas that are in fact affecting, how they show up even for men's reproductive mental health, the reproductive journey and vice versa. Like
Yeah.
the journey impacts everything else and everything else is impacting the journey. So really I do spend time talking with folks and looking at their whole reproductive story, their journey, and then the other areas. So are we leaning into your relationship? How are we growing your relationship? How are we like a lot of people have work stressors,
Mhm.
but they can't leave their job because, their job might have fertility benefits and coverage. Or they're like, hey, I've been here long enough. If I switch to a new job and I get pregnant next month, because that's always the goal, then I'm not going to have FMLA benefits because I will have only been there for 10 months. And so oftentimes people are staying in jobs where they're not quite happy or satisfied, but because they're trying to conceive, it's like we can't make this shift right now.
Yeah.
So yeah, so certainly can impact lots of areas. And then you have family and friends who are getting pregnant, and depending on the developmental stage of the person, they have a lot of family and friends who are having baby showers and getting pregnant and having baby number two and growing their families and constant announcements. And even when you go to work, you step
Yep.
into a work meeting and it's like, hey, so and so's pregnant. We're going to plan a baby shower. It's like, okay, well, I didn't have that on my bingo card for work meeting
Yeah.
today. I'm like,
Yeah.
oh, yeah.
Yeah. When you're in that journey with someone and you're sort of not weighing out, but in a way, like all of the different environments that they are in, all the bags of stressors that they carry. Like for our listeners right now, how could they sort of, I want them to come seek professionals, right? But for how can they do this on their own at home right now to sort of be like, hey, is this the whole thing? Like it does feel all encompassing. Let me take a step back and look at A, B, C, D, and E. How do you guide them on that?
Yeah, so one of my favorite things to recommend for folks that I'm working with,
Yeah.
and just in trainings and stuff, is to have certain days of the week or times of the day that you limit what we traditionally in therapy world call worry time. I have, infertility time. And so there's one of two ways that I recommend people doing this. And it can look different depending on where they are in their treatment. So if you're actively in the throes of treatment, then I recommend having worry time. So limiting it to, 1 hour a day, every evening between 5 and 6. We're going to kind of sit down, talk about this. Everybody can express their feelings or not. And if you're not actively in treatment, meaning like you're not currently taking medications, waiting on, a transfer or something like that, then maybe you can have worry days where, okay, on Tuesdays and Thursdays, those are the days that we're going to talk about fertility stuff. And a lot of the primary reason why I recommend that is not just to recognize that like you have other stuff going on in your life and not allow this to take over. But a lot of times, especially in folks who are coupled and partnered, they cope differently than their partner. So one person wants to lean in and talk about this every day, all day, and the other person is like, I'm sick of hearing about it. And so one person who wants to lean in may feel like my partner doesn't value me. They don't care about this baby. They don't want this the same way. And the other partner is just like, oh my gosh, all you do is obsess over this one thing. It's never going to happen. And so this kind of helps give them both the space that they need, where one partner can know, okay, I have a need and a desire to talk about this consistently. And I know that my partner is going to give me the space to talk about this with them on Tuesdays and Thursdays. Right. So I know, even though it's Monday, I know tomorrow, like we'll have some space. Right. And then for the other partner, they can know, okay, I don't have to deal with this every day. I can lean in and talk to my partner on Tuesdays and Thursdays because I know now that it is not going to be every day.
Yeah.
We don't like, it's not, the constant everyday thing for some people can be really mismatched. So this kind of process can really help folks to separate out and then to really kind of have a clear. And now if you're going through treatment, like you're likely to still, it's not that you're not going to think about infertility anymore, because you will, but being able to kind of, again, as those thoughts pop up, to remind yourself like, okay, let me make a note of that. And I'll kind of spend some time thinking about that tomorrow.
Yeah.
So sometimes people are like, oh, you see something on Instagram and now you're on a rabbit hole of researching this particular supplement or treatment modality. And now it's 2:00 in the morning and you've gone down this rabbit hole. So instead of that, you're putting an asterisk, making a note that tomorrow I'm going to discuss this. And then you're giving yourself a time limit, let's say 1 hour. At the end of that 1 hour, I encourage folks to find something physically tangible that they can do. So whether that's going for a walk, whether that's starting dinner, whether that's, watching TV, but something that's going to shift their mindset to kind of go to discontinue thinking about the infertility journey. Because if they just kind of sit there after the 1 hour, their fertility time is talk time is gonna continue to last.
Right.
So that could be something that's really helpful, useful for folks to do, the practical strategy that I encourage folks to do.
Yeah, I love that. I love that. Now, just explain to our listeners like why that works. Like give us a little bit of, meat to why they should do this because it's fabulous.
Because it helps the relationship. Like it really, really helps. And the folks that I've worked with, they have found that this really works because it helps them to have that intimacy for the partner that's looking for that closeness and wants to talk about it, and also that separation and that break. And for the folks who really like to lean in and can become, slippery slope of becoming obsessive, it can really kind of condense and really help you to kind of remind yourself that like there's other things that I have going on, and taking a break from thinking about this allows me to have a more clear mind. And because there's going to be nothing that's going to guarantee you a live birth outcome.
Sure.
Nothing at all in this world can guarantee you that. Right. And so it gives you a break from feeling like you're going to find that answer. And so I got to search and search and search until I find it. And so just emotionally and mentally, you're not spending as much time and effort and energy researching and looking and obsessing sometimes on, what I have this diagnosis and what are, I got to read what 10 different people have said has helped them, and, the research articles, and I got to, that stuff, it can consume you.
Yeah.
Right. It can take hours. And next thing you know, it's 2:00 in the morning. Yeah. So it's going to help you with getting better sleep. It's going to help you stay focused at work. Because if you're at work and you're in a work meeting, or you're supposed to be doing a task and now you've clicked on your next tab and you're on Reddit and reading through on that rabbit hole, like you're now distracted from work, right? So if you can kind of mark it that like, okay, I'm gonna give myself some time later to look at this, then it kind of gives your brain a break that like, okay, let me refocus on my work task, and I know that I can kind of look at this later.
Yeah, I love it. That is such a great tangible tool. And it guides us right into, like you noted that that's so powerful for communication between a couple. And we had talked about this in the quick pre-show, but like that you're about to put on a workshop for couples. Couples have sort of, in all of the conversations I've had in this season, we haven't really talked about couples. We talk about the mom or the woman involved. talk more to me about couples and what you see being the challenges there between the partners. And let's carry through that because that's an interesting topic.
Yes, absolutely. So a lot of times the main thing that I see is the disconnect and the way that they are coping. People cope differently. One person can be a task oriented coper and the other person is like, I'm going to just focus on work and that's going to help me. And that can really put a lot of weight on the relationship, because one person wants to lean in while the other person is like, I want to lean out. And so folks feel already on this journey, folks can feel alone and lonely because it's not something that's often talked about. And so when the one person that you're going through this journey with is not giving you what it is that you particularly feel like you need, then it can like make you feel even more lonely, more disconnected. And so that can be, something that's challenging. But I do want to also say that like sometimes for couples, it really, this journey and this process can help to pull them closer together. Because sometimes for some folks, they look at it as a challenge that they're facing together.
Yeah.
And so they're working together kind of as a team to, navigate this. So we're going to appointments together. I'm the one who's receiving the shots, but you're the one administering the shots. One person, and I talk to couples about how to navigate and set some of this up, because the mental load of this fertility journey can be really heavy. Having to remember particular dates, having to remember medications, having to remember to follow up with the doctor's appointments. Oh, I can't find the Band-Aids, that the refrigerator needs to be on this particular temperature. There's just so much nuance that sometimes like we can really get consumed with it. So being able to kind of separate some of those tasks out and say like, okay, you're, going to handle the medication piece. So if there's an issue with medication, you're handling that. You're administering the medication. Like for me, when I went through it, my husband, I was like, you're on meds, right? So I never gave myself one single shot, and there was a lot of shots to be given. I never gave myself any shots. Thankfully, my husband was there. I was like, that's your thing. He has mixed it. He had to be in charge of mixing it, making sure we had enough. I mean, and of course there's some coordination with the fertility clinic and the pharmacy. But that was his part. So, but sometimes again, you have partners who are kind of disconnected and one partner is like, I'm not doing all that. And then also you have people in partnerships who tend to be the doers, right? They tend to be the coordinators, the organizers, and the task. And so like I'm doing because I'm just used to this until I crash out and realize like, man, this is overwhelming. This is way more than I expected. And now I'm doing it by myself. And folks can start to kind of grow some resentment that like my husband is just, sitting here playing video games or, hanging out with his friends, not even thinking about the 20 million things that I've had to think about today, right? And it's not always because their partner is not interested or invested. It's just, this is kind of your strength and you took it on, and nobody at the beginning, neither of you probably recognized that this is what it was going to be involved.
Sure.
Right? People don't go into this journey thinking like 2 years later, I'm going to still be doing this, right? Every month you think this is our month, right? Like I'm going to be done this month. So I encourage folks to kind of work together with their partner to come up with a plan. This is why I kind of created the retreat that I am, going to be doing in the next couple of weeks, because I see so many people individually, which can also be very hard to see an individual, to work on relationship challenges. So I also offer some coaching, and consultation for couples, to help them kind of set up some of these things, right? And so recognizing that, even physically I'm the one who may be dealing with the physical side of having to go through treatments, having to prepare my body, all of that stuff. But what is it that you can contribute to this process, right? And kind of working through, what does that look like? And again, what are strengths, right? Because I have so many people who are like, it would cause me to be more anxious if I let my husband do the medications.
Sure.
So that's just, I just have to take that on because I would be more stressed out if he was doing it. I don't trust him. And so we have to kind of work through now, like, how do you deal with, this is an area of strength for you. And so what is something that you can pass off? What is something that you can say, okay, and it might not be fertility related. It may be like, hey, actually, you need to cook meals for the next couple of weeks.
Yeah.
Like, let me take that off of my list and I will deal with all the med stuff. Right.
Yeah.
So there's kind of like give and take, because again, it can really add weight to the relationship, but it can also sometimes kind of pull folks in closer together
Yeah.
and just feel connected as well.
Yeah, absolutely. Like really honing in on the partnership piece of carrying the load. I love it because, and I'm putting my own words, but I hear, just in with the tool that you gave to sort of have days or even hours of really thinking of, feeling of, being in like the infertility mindset or treatment mindset. Same with, it's a boundary, right? Like same with these boundaries of giving each other, having duties and things within the journey to partnership up. Like boundaries, I can talk about them all day. They're harder to set, but they're absolutely a beautiful thing. So I appreciate your insight into it all. Now keep going down the timeline, right? I have a couple listeners and friends and patients, but 2, 3, 4 years into this journey, right? So at that point, there seems to be just overall burnout, right? There's still some glimpse of hope, but it's almost, and some of the other people have talked on this, like almost like a stuck point where like, if you stop, right, then there's a give up. And I could have, would have, should have. Do you see that? And talk about that for us a little bit.
Yeah, I see that a lot. Oftentimes when folks are at various different points, a couple of different points. So
Okay.
one, I see when folks are contemplating just, living a life with being child free, not by choice. The other I see is when folks are contemplating moving to donor egg, donor sperm, donor embryo,
Okay.
or moving to surrogacy. These are all the options. These are the most common from my experience of when folks start to kind of toggle with, do I keep going or do I stop and accept this is where we are, right? And that can be a very challenging and tough space because sometimes the medical providers are, giving you sometimes minimal information, and sometimes they're giving you too much information. And so just depending on where the providers are, it can be helpful or it can be, less helpful. But that's oftentimes where I see folks. And, a lot of times they are struggling with, am I going to later regret this? Right. Whether I decide to move forward with donor egg or decide that, we're just going to live child free. It's a really tough decision. And I really encourage and remind my clients when they're looking at these decisions that honestly, no matter which choice they pick, they're going to have these same kind of grief like thoughts around like, coulda, shoulda, woulda, what would have happened if I would have gone with the other choice.
Yep.
Right. And what is too much, right? Because the number one reason why people discontinue treatments is psychological burden, right? The psychological burden of infertility treatments and infertility has been compared to that of someone going through cancer treatments,
Okay.
right? And there's some research on that. And so when folks are thinking like, oh, this is just physical, and if I can deal with the physical side, the mental side and the psychological side is like the roller coaster, we call it. It's like a theme for infertility, is hope and despair. Hope and despair, right?
Yeah.
There's some hope as long as you continue to move on, you have some hope. But month after month of not reaching your goal, there's a position of despair. Right. And so there's this roller coaster of ups and downs and ups and downs. And like I said, people put their life on hold. They're not going on vacations. They're not changing jobs. They're not moving up in their careers sometimes. They're making a lot of life decisions based on like, I'm hoping to be pregnant next month. Right. Some people are having to go through surgeries, multiple different types of surgeries just to get to a position of trying to conceive again. And so it can be so much. So a lot of patients that I've worked with are facing this, like, what's the next decision? What's the next decision making and decision making fatigue is something that is really common on this journey too. And so I encourage folks again to, really write out what are all my options, right? And what are the benefits and what are the risks here, right? And really reflect and really spend some time with that and think about what are the things that I value in life and in my life in particular, in my partner. And then, doing all of that kind of can help to make a decision on how to move forward. But again, at the end, I tell them, no matter what you choose, no matter what choice you make, part of grief is that like you may likely feel like, well, I wonder what would have happened if I chose this other option. And you're never going to know what it's going to actually be like until you make the choice and you're in it.
Yeah.
And so I also like to remind folks that like you're making these decisions right now with the information that you have right now.
That's right.
5 years from now, you're going to have different information. Maybe you can say, I would have made a different decision if I knew what I know now.
Yeah.
Right. But you don't.
That's right.
Right.
That's
So
right.
you have to just make a decision based on what you know right now and how, we don't have control over the future and can't predict what is possibly maybe going to happen.
Yeah, absolutely. That's beautiful. And on that note, like as you're, I'm sure that you have done the same with all of the information you know now as an expert in the field versus when you were just starting your journey. But being where you're at now professionally and with the individual work for like, what's your dream 3 to 5 years for where even the rhetoric around infertility and treatment is going to go? What do you see and hope for?
Well, what I see and what I hope for, I think are probably different
Okay.
considering the
Please.
politics around
Absolutely.
health.
Absolutely.
It is pretty, it's a currently high, I think, anxious point of what is going to happen,
Yeah.
right? We've seen Roe v. Wade overturned. We see, lots of conversations about IVF protections, and I participate each year with Resolve. They do a federal advocacy day event where we are advocating with our senators and our representatives for access to all things like that. So just depending on politics, unfortunately, like who knows what the next 3 to 5 years are going to look like. I can't say. I can't even guess where things are today. Where I would like them to be, what I would like to see, not even on like a federal level, but I would just really love it if we could shift and start talking to folks and educating folks at much younger ages on infertility, on conception, on just reproductive health. Yes. Right? So many people are misdiagnosed with endometriosis or underdiagnosed with endometriosis, PCOS. These things are dismissed. Fibroids, especially in the Black community and for Black women, these things can be like just not, we just put Band-Aids on it and give you some birth control and, go, minimize some of the symptoms. And it's not until we're on these journeys to conceive that we're getting some of these diagnostic testings, that we're getting some testing that's done, that we are getting diagnosed and then getting treatment for these health issues. And then just like, I just had a client this morning, a new patient this morning, who was just sharing how, she just wished that she would have known. She was 36 years old and had insufficient ovarian reserve. And sometimes, all the messages now is, wait 6 months, try for 6 months, try for 12 months. But realistically, you don't have to, especially if you have insurance to cover some of the basic testing. You can do a little bit of baseline testing whenever you decide that you want to start trying for a family. And even if you say, you know what, I want to delay it for 2 years, you can still go to your doctor and get some preliminary testing. So just have an understanding of where your fertility is today, rather than when you're 38, 39 years old and you learn that like, oh, actually one of your tubes is blocked, or actually you have, if you do not have your cycle regular, your period, your menstrual cycle regular, like I just wish there was more education and awareness around just some basic infertility stuff, some basic fertility stuff, so that folks are not so blindsided when they start trying to conceive and they're a year in and they're now just going to see a fertility doctor who then tells them that, there's some issue that potentially could have been diagnosed and addressed earlier. And it doesn't mean that like, oh, I'm going to go and, preserve my eggs or decide to start my family sooner. But again, it's about having the information and the knowledge so that you're making an informed decision. Absolutely. Right? We just oftentimes assume that when all these messages from when we're younger, like don't have sex, you're going to get pregnant. Don't have sex, you're going to get pregnant. Like you expect that like when I'm ready to have sex and get pregnant, it's going to just happen. Right. And that is not the case for many people. Yeah. And so just really, I just wish there was more awareness around that and that people are starting to seek, again, even just baseline testing to be able to make informed decisions about their family building.
Yeah, I love it. Preach it from the mountaintops. I love it. And truly like, and I'm glad you bring this up because I'd love to end on this. Like knowing what to advocate for, because that is part of the problem when we've had such limited understanding of even our own body, our own cycle, like even knowing what to ask for, because we're still in the Western medicine world, right? Where you have to you're going to have to push, you might have to push pretty hard to get the things that you want. Right. And so I guess a question to you is in the infertility, arena, obviously that's what we're talking about. Where do you see the discrepancies, if I may, of where there's just like a simple answer given when really, if we knew more, we would advocate for B, C, D, and E? Does that question make sense?
Yeah, I mean, I think potentially, and this is not to badmouth OBGYNs, but it's just, I think that, again, it's a whole system problem, right? It's not one particular provider. It's just how providers were trained and how the system was set up. But I think that, a lot of times people, like a patient I had this morning who was just like, I went to my OBGYN telling them I'm going to start trying to get pregnant. Right. And I noticed that there's something off with my period. Right.
Yeah.
And so I think just like more training for OBGYNs on when to refer out and how to talk to patients about these things, and for patients and for people to ask the questions to their provider and to say, is there some testing that I can do? There's transvaginal ultrasounds, there's blood work. Those are like less invasive treatment.
Right.
Less invasive testing options to just give you a just general idea of where your fertility is right now. It's not definitive and can't guarantee, a year from now what that will look like, but at least folks have some of that understanding.
Yeah.
And so I think though that a lot of times OBGYNs are generally like, oh, you got to try for 6 months. Oh, have you been trying for 6 months? Well, don't worry, because, the research tells us this. And while that is true, the research does tell us that, it's only a 20 to 25% chance of conception every month.
Right.
Right. Like for folks who don't have fertility issues. So it's really not, don't have sex, you're going to get pregnant the way we thought it was. So we do know that, and we do know that, a large portion of people do get pregnant within the first 12 months of trying to conceive. However, again, there's not just those factors. And also ASRM, the American Society for Reproductive Medicine, that's the ACOG of reproductive endocrinologists and fertility specialists. They updated their definition of infertility back in October 2023. So just very recently, they updated the definition to be more inclusive. So to include that, like, if you have potential other medical issues that may indicate or may, give you an increased risk of fertility challenges, you may not need to wait 6 months or 12 months, depending on age. You may be able to just go to your doctor. And so hopefully like that starts to shift even with OBGYNs, that they do more baseline testings and just have these conversations with people about their family plans. We talk to the OB is always ready to talk about birth control. Yeah. Are you on birth control? Are you on contraception? Like, what are we doing here? Right? Like, you just barely had a baby, and they're like, what do you want to do for birth? But we're not talking about family building and fertility. Right. And like, what are your goals for your family building? And when do you want to start trying to conceive? Right? Yeah. Have you thought about that? How regular is your cycle? Like, having actual conversations, because again, it's not being something taught in schools or anywhere else. And so it's when people are coming in for these medical appointments that I wish that, we would have more conversations about just routine, kind of screening.
Routine. And just knowing, it's funny, since I've gotten into the learning about what women do and do not know about the reproductive system and health, like just knowing that what the first day of your period even means every month, like simple, simplistic things that we're just not, we're not talked about, or we haven't researched. So I appreciate the power and the voice. I have one more question for you, and it's based on a line you had on your website. So it was the line about the power of turning pain into purpose, and that stood out to me. Tell me about that before we're done. Tell our listeners what that means.
Yeah, so I say that because when I was going through infertility myself, I was dealing with depression. Yeah. I was dealing with anxiety. I was dealing with a lot of grief. And I reached out. I found a few different therapists and was like, I need help. I reached out to my clinic. They offered support groups. But this is long before COVID. And so everything was only in person, and it was, 2 hours away for the support groups. The therapist that I worked with, I spent so much time just trying to educate them on infertility and IVF and all the things that are nuanced that couldn't really just sit and be present with my feelings. And so, throughout that journey of pain, like psychological pain and emotional pain and mental pain, now that has led me to my purpose and what I do with other folks. So being able to be that voice, and especially as a Black provider, I want to also emphasize that, like, there certainly wasn't anybody who looked like me at all. But to have someone who specializes in reproductive mental health and infertility specifically, and maybe for Black folks or people of color who have someone who looks like you, to be able to help, navigate this journey of, emotional distress. And so that is to me, when I say, like, I have turned my past, pain into my purpose, like, this is my purpose. And I also realize that, this is this is my testimony, and this is my story, and this is why I went through this journey, unfortunately, that I had to go through it. But now I look at it as, like, there's so much more meaning now in what I went through and how I can give back to others and support other people on their journey.
Goosebumps. Absolutely. Thank you. Thank you for your mission and your passion. And yeah, even sharing your testimony is a great word for that, right? The story that you've lived to help heal others is a beautiful thing. That's a bumper sticker. I don't know why you need to print it. I'm telling you, I've heard some great bumper stickers today, but like, because pain is so common for us. And when we feel it, if we could turn it into a purpose, it is powerful, especially for women. Women are powerful, powerful beings. So Shatiera, this was amazing. You are a passionate, strong woman. I'm honored to be in your presence. Anything else we didn't hit on that our listeners should know in regards to what we talked about?
Actually, two things.
Yeah.
One is that I see common, especially if the audience is more perinatal, pregnant, postpartum, is secondary infertility. We didn't really talk about that, but it is very, very common, and it can be very difficult to navigate. A lot of times folks do not even connect their experience with infertility because, well, I got pregnant, I already had a kid. So, like, that doesn't really apply to me.
Right.
So again, folks are not receiving treatment. They're not getting support. They're just kind of suffering from recurrent pregnancy loss potentially, and just thinking about it in that category. And so they just stick with working with MFM, and, and that's fine for some people, but I do want just people to recognize that secondary infertility, things can change. Even though you've had one successful pregnancy that resulted in a live birth, that does not mean that you may not experience infertility challenges after you've had that first child or second child even. In fact, I have a client who has 3 children and is trying to conceive and struggling to conceive her next child. And that can be a little bit more jarring because there's a lot of guilt that, like, I should just be happy with what I have, right? I should, be sad and whatever because I can't have another child when other people just want one. And absolutely validating those experiences for people who are having and experiencing secondary infertility. And then just the last thing that I want to leave everybody with, and any listeners, hopefully, if you are not having a regular menstrual cycle, if you have any reproductive health issues, maybe you've had fibroids in the past, cysts in the past, any reproductive health issue at all, and you are looking or wanting to start and grow your family, do not be afraid to reach out to an infertility specialist and just get testing. Sometimes a lot of folks are afraid to go to the reproductive endocrinologist because if I go to them, they're just going to tell me I got to do IVF and I ain't got the money for that and whatever, or that's not my issue. I don't have an issue just yet. I don't need to see the infertility doctor. And while that may be the case, it is not going to hurt you to have the information. Right. And a lot of times testing is covered under insurance. Treatment is a different situation, but the testing oftentimes is covered. So talk to your insurance company, talk to your providers, and seek help. Do not wait and delay. Seek help. That is what I would like to leave folks with.
Absolutely. Absolutely. And I'm so glad you end on that note because they're not necessarily, just like you said earlier on, like there is no promise of a living baby coming from this, but there are ways we can find out about our body and have advocacy for what we want, could have. I think it's great. And you don't have to wait until you're 38, 39 and having challenges. I think that's a main key we're finding out in lots of phases of womanhood. You don't have to wait till you don't have to sit and take it, like get answers now. So I love it. And I think your social media is fantastic. I'm going to tell all people to follow you and we can learn more just following individuals such as yourself who constantly share this information is just good for us to know. Even if I have a friend going through it, it's a better way for me to be present for them.
Absolutely.
So I
Absolutely.
appreciate that. I appreciate all the things you said. I love it.
Thank you
I
so
love it.
much for having me. I really appreciate you welcoming me to be able to share
Yes,
a little bit more about my journey, my story, and how I support others.
absolutely.
We're talking about fertility. Thank
Yay!
you.
I can see the shine on your face. This is an IVF mama with a story to tell. Shatiera, we're so grateful to have you. Seeds of Hope is your counseling center. Your website's fabulous, by the way, and your logo's great. Side note. But anybody, we will have all of her information in the description. And we thank you for listening today, and we will talk to you all soon.